This is CBS News Miami Morning Edition.
Today is World IBD Day, a day meant to raise awareness about inflammatory bowel disease. And it has special meaning for my family because my older daughter was diagnosed with Crohn's disease last year. Joining us today is Dr. Lina Maria Felipez, pediatric gastroenterologist and associate medical director of the IBD Center and director of IBD research at Nicholas Children's Hospital. Thank you, Dr. Felipez, for being with us today. It's so good to have you with us.
It's great being here. Thank you for the invite.
Oh, of course. You're welcome. You know, I want to begin by just having you explain what IBD is.
So inflammatory bowel disease is a disease that affects your body, but mostly your intestine. So your intestine gets inflamed. It is divided between Crohn's disease and ulcerative colitis.
And what is the difference between Crohn's disease and ulcerative colitis?
Yeah. So the number one difference is that Crohn's disease affects anywhere from your GI tract, meaning all the way from your mouth to the anal canal, and ulcerative colitis affects mostly the colon.
And what are some of the signs and red flags that people should look out for to determine whether they or their loved one may have IBD?
Sure. So maybe that we can divide between adults and pediatrics, right? In the adult world, maybe a person that is experiencing severe abdominal pain that is chronic, it doesn't go away, diarrhea, blood in the stools, mucus in the stools, losing weight, not able to eat. And in the pediatric side, I think the number one red flag will be when you go to the pediatrician and you started noticing that that growth curve starts decreasing, right? The growth and the weight start decreasing.
Yeah, when my daughter was diagnosed with Crohn's disease, I think one of the hardest things for us to hear is that there isn't a cure. This is a lifelong disease. And of course, at the time it was heartbreaking, but there are treatment options. And I wanted you to explain what those different treatment options that are available to IBD patients.
Sure. So I think that's the first thing that the patients and the families it's hard for them to listen. I agree with you. And it is a chronic disease. It is a chronic disease such as diabetes and asthma. They will live with it. But I tell them, right, there's your kids, a lot of research is being done, so hopefully in the future we'll find the cure. But there's different ways of modalities of treatments, and I think advanced medical therapies that are in the form of infusions or injections, and that ranges, right? But also nutritional therapies, right? So there's a lot of diets that we can do that helps the gut and the microbiome and helps them as well. So there's different modalities of treatments, and a lot of research is being done in this area, so it's a promising field.
Thank you for taking such good care of both my daughters. We're very, very grateful to you.
It is my pleasure.
If you have any concerns your child might have IBD, the pediatric gastroenterology team at Nicholas Children's offers dedicated, specialized care for children across South Florida. And you can find more information, resources, and donate to help find a cure. Just go to Crohn'sColitisFoundation.org.